Kevin, thank you for joining us today. We're excited to talk about some of your research projects that you'll be presenting at the Heart Rhythm Society Scientific Session in Chicago. Tell us a little bit about one of the exciting studies that you have underway.
So one of the ones that we're presenting in Chicago, it's what we did, we're looking at the Intermountain Mortality Risk Score, the IMRS, that was developed by Ben Horn, also from Intermountain. And we're applying that to atrial fibrillation patients and looking at the outcome of dementia. As a lot of previous research has shown, atrial fibrillation and dementia are pretty linked, especially as your risk factors go up. Traditionally, they use the CHA2DS2-VASc score. And what we've done is we've applied the IMRS within those various strata of the CHA2DS2-VASc to kind of really tease out the more sensitive patients, those who are at higher risk, even in those lower risk strata of the CHA2DS2-VASc. So I think an important thing to remember with this research is that dementia is also another risk that we have to consider when we're talking about treatments for atrial fibrillation, and using the IMRS gives us a good chance to kind of really identify those high-risk patients who would benefit most from treatment.
Yeah. Is there a significant population of patients who could be affected by this?
Yeah, I think so. You know, right now with CHA2DS2-VASc, you know, they recommend treatment with anybody who has a score of 2 or higher, and that pretty much accounts for almost somewhere between 70 and 80% of all patients with atrial fibrillation, just based on your clinical risk scores. And with this, we might be able to kind of identify some people who are in that higher risk area and be able to maybe say they're not as high risk, and vice versa, those lower risk patients, we might be able to say, well, you actually are at maybe a little bit higher risk, so maybe we do want to be a little more aggressive in our treatment.
As a researcher, what do the findings mean to you?
So I think one of the biggest takeaways from this is one that we need to really look at atrial fibrillation in kind of a different scope and view it more as this systemic disease that's really based on a lot of underlying risk factors that aren't necessarily accounted for, you know, with just the CHA2DS2-VASc. And so it really is something that we need to kind of look at more in terms of prevention and really, you know, identifying those people who are low risk and high risk, because there's you know, we don't want to treat people who aren't going to benefit.
That's great. Well, congratulations on this exciting research, and thank you for joining us today.
Thank you.